When it comes to your heart health, what you mostly hear from your professionals is exercise, often go on a diet or avoid smoking. But now let's talk about this sleep, the sleep that everybody observes at night. Some of us might even wonder, is there any big deal about this sleep regarding your heart? But did you know that one of the best ways to protect your heart is as simple as a good night's sleep, an adequate quality sleep? Sleep plays a major role in keeping your heart healthy, even more than you can even think. Now we're going to dive into the fascinating connection between sleep and your cardiovascular health. Did you know that your heart rate and blood pressure naturally drops when you sleep? Yes. That nightly rest that people go to bed at night to sleep, it goes a long way in reducing your blood pressure, almost like a built-in tune-up after a full day's work. Without that adequate sleep, your heart will always be under constant strain. Now, study has revealed that people who consistently miss out on adequate sleep of between 7 to 9 hours per day have a greater risk of developing high blood pressure, heart attacks, and stroke. This risk has been shown to even go higher when your amount of sleep is reduced to 6 hours per night. Now, what is the reason behind this? It has been shown that insufficient sleep affects everything from your blood pressure to even inflammation in your heart, which puts a long-term stress on the heart's function. Did you know that even when you think about how your body is deprived of sleep, it can go a long way in affecting the heart's function? Lack of sleep has been shown to trigger the increase of a stress hormone called cortisol. Now, cortisol increases the blood pressure and makes your blood vessels stiffer, which increases the load of your heart. What that does is also now going to even worsen your chronic sleeping patterns, and then it will increase the level of inflammation in the heart, which directly is linked to atherosclerosis, which is a buildup of plaque in the arteries. Oftentimes, this restricts blood flow and increases the likelihood of developing heart attacks or strokes. Did you know that it's not just about how many sleeping hours you have, but also the quality of that sleep? For example, some people have what we call sleep apnea, where breathing repeatedly stops and starts during sleep, and they have a higher risk of developing heart issues. Sleep apnea keeps the body from fully resting and has been linked to higher blood pressure, heart failure, and irregular heart rhythms. If you are a loud snorer or feel exhausted even after a night's sleep, consider speaking with a healthcare provider by being assessed for whether you have sleep apnea. Good night's sleep affects our heart in various ways. 1. Lowering blood pressure. Research has shown from the Journal of American College of Cardiology that people with poor or disrupted sleep tend to have higher blood pressure. Even a small increase in sleep duration has been shown to benefit your blood pressure levels. 2. Reduce risk of heart disease. Long-term studies, including one by the American Heart Association, indicate that adults who sleep from between 7 to 9 hours per night have a lower risk of developing chronic or coronary heart disease, while short-term sleepers, that is those that sleep less than 6 hours, have an increase of 20% of developing heart disease. 3. Reduce inflammation. Poor sleep can elevate inflammatory markers like your C-reactive protein called CRP. Studies in Sleep Medicine Review highlight that good sleep lowers CRP levels and other inflammatory markers, reducing heart disease risk. 4. Lowering risk of arrhythmias. Studies have shown that untreated sleep apnea increases the risk of irregular heartbeats, such as atrial fibrillation. According to the Journal of American Heart Association, effective treatment of sleep apnea lowers this risk. 5. Improved heart rate variability. HRV, an indicator of how well your heart can adapt to stress, is higher in people who sleep well. Yes. Research from Europe Heart Journal shows that chronic sleep deprivation lowers your HRV, which can be a risk factor for cardiovascular disease. 6. reduce risk of stroke. Research from the Journal of American Academy of Neurology found that short sleep is associated with higher stroke risk related to factors like high blood pressure and diabetes. And lastly, lower mortality from cardiovascular causes. Studies have shown that improved sleep reduces mortality from cardiovascular diseases. Moving on to tips for heart healthy sleep, we want to talk about practical tips to support your heart health and your sleep. First of all, stick to a schedule. Go to bed and wake up at the same time every day. This helps to regulate your body's internal clock and benefit your heart health. Second, create a wind down routine. Avoid screen, caffeine, and heavy meals before you go to bed. Try light stretches or reading to prepare your body for rest. Thirdly, exercise regularly, but not too late. Regular physical exercise, it actually supports your heart health and better sleeping patterns. But try to finish your workout few hours before bedtime. Fourth, be aware of snoring. If you know you sleep loudly or you snore loudly or feel tired at the end of your sleep, make sure you check for whether you might have sleep apnea. And if you have such, treat it. Also, if you have high blood pressure, ensure you treat it. Listening to your body. Do you often wake up feeling refreshed and energized? That is a good sign of both your sleep and your heart health. But if sleep feels like a struggle, then remember, even small changes in your pattern leads to big improvements over time. The takeaway from today's episode is quality sleep is more than just rest. It's an important ingredient in keeping your heart strong and healthy. So tonight, when you go to bed, think of it as one of the best things you can do for your heart. Take care of your sleep and your heart will thank you for it.